Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center reporting for the week of June 6, 2022. Been getting a lot of questions and calls about having someone in the household who's tested positive for SARS-CoV-2. How do you navigate that? And just how do we navigate this fifth wave of COVID in general? As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. When we take a look nationwide, right now, we can see that there is quite a bit of community transmission in the United States. We can see that 81% approximately are considered, of the areas in the United States, are considered high community transmission. And this is looking at counties across the United States. And another 11% substantial transmission. There are a few places that are going back down. So that's good news. Hopefully that will make its way out west soon. But right now, the majority of California is in a high transmission situation. And we look here in Alameda County at 14-day case rates. We're at almost 11,000 cases. This is a little higher than what I reported last week. But maybe we're starting to plateau. Difficult to say. It's going to take a little longer before we know whether that is a plateau or whether we're still headed up. So we'll be keeping a close eye on that, but it's still significantly high, particularly when you take into account that for every lab test with this wave, we've probably got another 7, 8, 9, something like that, home tests in addition. So we know that this is a massive undercounting, yet it's still high. With our percent positivity, we're at about almost 11% positivity rate. That is very high, a little difficult to interpret because it's hard to say who's coming in to get a lab test versus what all is going on at home. Still, we don't like to see positivity rates looking this high. And the other sources of data that I like to look at have to do with where asymptomatic testing is going on. My favorite source for that was the Oakland Unified School District dashboard because they were doing a lot of testing. But that unfortunately has not been updated since May 23rd. School is out, so it may be that that is not a source we can look to over the summertime because testing has ramped down there. So we're continuing to just have to try to look for other ways to get a sense of what is going on and do the best with what we've got. Hospitalization is a key indicator that we've been looking at, not only because it tells us how we are doing, it's of course a lagging indicator behind cases, but also because hospital capacity is such an important variable for us to be looking at just in and of itself, because that will affect not only how people do with COVID, but also with everything else that they might need the hospital for. And glad to report that it's down a bit from last week. We were at 118 last week. Now we're at 112 in the hospital with COVID. We had 13 in the ICU last week. Now it's 12. So a little better. Can't tell again whether this is going to keep heading down or whether we're plateaued or whether we'll keep going up. A little too soon to say. So we will be keeping an eye on that. And remember, the hospital capacity piece is very critical. And for that reason, the CDC actually made its main map actually about hospital capacity. And remember, not too long ago, it was completely green. Now we're seeing it's not completely green. So this is concerning to see so many places in the United States that actually have concerns around their hospital capacity. And also, concerningly, Alameda County is one of those places. So this week, we see that Alameda County is in the high community level. And the community level is based upon new hospital admissions for COVID and the percentage of staffed hospital beds that are being used for COVID. And it's then kind of correlated with how many cases we have. So when you take it all together, the CDC actually considers us to be at a high community level. So that's pretty concerning. And what it means is that the recommended actions based on our current level is that we wear masks indoors, in public, and on public transportation. This we have felt is like by the time you have hospital capacity challenges, this might be too late to be implementing masks. But luckily, our public health officer already reinstated the mask requirements on June 3rd. So hopefully that will be doing enough to help keep cases down and keep hospitalizations down and to get us out of this high community level that we find ourselves in currently. And one thing I wanted to address was deaths, because it seems that there was kind of a notion that we lost a lot of people, sadly, in our prior waves, especially in Omicron, that we just have. Folks don't seem to have the sense that we're losing people after the Omicron wave. And unfortunately, even right here in Alameda County, since April 1st, 38 people have lost their lives to SARS-CoV-2. So we are still losing people from this virus, 38 people since April 1st, just here in this county. So that is really concerning. And we don't have yet the vaccination breakdown specific to this county around who has died. But when we take a look nationwide, and this is an analysis from Kaiser Family Foundation, and you can see here that, and this goes through the Omicron wave, so this is not current, but just to give you an idea of kind of how things are going, still the vast majority of deaths. So both of those blue colors, if you take that medium blue and dark blue together, those are all unvaccinated folks. The lighter blue is our unvaccinated elders, and the darker blue is our other unvaccinated folks. And then we have our vaccinated elders and our boosted elders who have also lost their lives. And so we see that we are still losing people who are vaccinated. Some of this is going to be a function of how far out they may be from their vaccination. But the boosters clearly are protecting folks. And so even though we know that there still can be poor outcomes even among the vaccinated, by far the vast majority of people who are dying are not fully vaccinated. And so really getting boosted is important, especially for our elders. So remember that right now what the CDC is recommending is the first booster. So that's the third shot for most people. For some people, it'll be their fourth if they're immunocompromised. But first booster for everyone 5 and up, 5 months after the primary series. Second booster right now is approved for everyone 50 and up, as well as anyone 12 and up that has immunocompromised, and that's 4 months after the first booster. So if it's been 4 months since you had your booster and you're 50 and up, then we are recommending that you go ahead and get that booster. And certainly if you're over 65, over 75, these are the folks that we really, really want you to get that second booster because there is still that vulnerability that we're seeing from being too far out from the last shot. So please do give that some consideration. We're still seeing that there are very large numbers of folks who haven't even received that first booster. So if you're 50 and up and you haven't got the first booster, I think now would be a good time to do that. We are in a surge. There's definitely no question about that. And this would be a good time to protect yourself, because you don't want to find yourself in that situation where you've been exposed or you've got someone in your household that's got it. Now you don't know if you've got it or not. Now it's like too late to be running down to get the booster. You're going to have to wait to see if you caught it and then get it later. We don't want to be rolling the dice like that. So now is really the time to make sure that you are up to date. And on the vaccine updates, Novavax was given the green light last week by the FDA's VRBPAC committee. Still not clear when we're going to get our supply of it, but we will certainly let you know as soon as it seems to be hitting the streets. Remember, this is kind of an older type of a technology, the kind we're used to, like with our flu vaccines, a protein subunit vaccine. It's a 2-dose vaccine for those 18 and up. And the effectiveness, the efficacy is looking really similar to the mRNA vaccines. So we're looking forward to receiving those. And this week we should be hearing something about the under 5-year-olds. It could be approved any time really in the next, maybe even as soon as June 21st. So we are waiting to hear the deliberations and learn of the decision on the under 5 vaccines. I know a lot of parents are waiting for that. And on the variants, so we've got some new shades here. We've got some new shades of green. Those are the BA4 and the BA5 Omicron sub-variants. So that kind of salmon color, that was the BA2.12.1. That was the one that was really picking up steam and kind of taking over. And now BA4 and 5 is even more contagious, and it is starting to displace the BA2.12.1. So, and as I reported last week, the BA4 and 5 is quite a bit more resistant to the protection that we have mounted from our vaccination and prior infection to the other Omicron subvariants or any other COVID for that matter. And so that's concerning because we're just worried that it will evade our prior immunity. And certainly we are hearing about people getting it second and third time. So we will be keeping an eye on these variants, but really each of these variants has kind of been more contagious than the one before it. And as the variant's contagiousness increases, it's just going to get harder to avoid infection, but it is not impossible. And it is not inevitable that you have to be infected, even with a household member who is positive. In fact, we know a lot, we can do a lot. And as I reviewed on a prior briefing, it's probably not going to be possible to avoid being exposed to SARS-CoV-2, but we can avoid being infected with all the different tools that we have at our disposal. And even if you think you have to catch it one of these days, I'm not sure if that's the case or not, but I would rather delay it as long as possible because we learn something new all the time. And we are gaining more insights on what is going on with SARS-CoV-2, how I'm hoping we're going to learn how to prevent long COVID. We're going to learn how to treat long COVID. We're not there yet. Still a lot we don't understand. And if you have to catch something, it'd be better to catch it when we have more, a broader knowledge base about how to avoid some of the consequences of it. So I say, why not do everything in your power to keep from catching it, even with a household member who has caught it? And we are helping a lot of people navigate through that situation. And I'm pleased to say that we've seen a lot of success at being able to avoid it, even if someone in the house has gotten it. So not easy, but there are lots that we can do. And there are studies that are actually backing this up. So there's a lot of variables when it comes to just a household, right? Every household, every home has different features. You might have more crowding, less crowding, and so on. We've got vaccinated, we've got unvaccinated, we've got boosted. So these studies aren't exactly easy to do, but there's a couple that I thought were worth kind of looking at, and they're in the post there. One of them was a huge meta-analysis, took a lot of different studies and kind of put them all together and drew out what it could. And bottom line is that there is more transmission within households with Omicron compared to Alpha and Delta. And there is more transmission in households to people who are unvaccinated. So when the person who catches it is vaccinated versus unvaccinated, unfortunately, these studies didn't show a whole lot of difference. But when the person who is in the home and trying not to catch it is unvaccinated, then of course there's a much higher likelihood, in fact, more than twice as likely to catch it in the household if you're unvaccinated. So certainly if you're in a household with folks who are out and about and doing their own thing, you know, and you don't know what it is they're doing, being vaccinated and boosted is definitely the best protection that you can get. This is the best protection you can get, period. There was also a morbidity and mortality weekly report that looked at this same issue. The attack rate is what it's called, or the secondary attack rate. So someone in the house has it. What's the chances someone else is going to get it in the household? And not surprisingly showed that when the positive person really isolates, like for real isolates, then that can really lower the chances of anyone else in the house getting it. So somewhere around 40% compared to 68% that got it when the person didn't isolate. That's a pretty big difference. So getting that person to isolate if possible is definitely the thing to do. And when the positive person wore a mask, it also greatly reduced, again, 40% in the household caught it when the person masked compared to around 70%. So again, there's a lot of nuance here that you can't really get in some of these type of studies. But bottom line was, as you can see here, that about 1 in 2, so 50% or so of the household contacts developed COVID-19 from a positive family member. So again, the ranges, you know, have been different, whether it was Alpha, Delta, or Omicron. Is different if you're vaccinated, unvaccinated, but the behavior is what can really make a difference. So if we're at about 50% on average, you got a 1 in 2 chance of not catching it. And I think with adding all the right layers in place, it is definitely doable. And it's definitely going to be harder if it's a little one who's got it. So if it's your baby, it's going to be much harder to not be obviously in close proximity to them to catch it. But with the right masks and the right precautions, we've also seen that people have been able to avoid it. So don't give up hope. Definitely don't throw caution to the wind. And just because if you've had COVID before, this also doesn't mean, oh, you can just take off your mask and brave it because you're somehow immune. No, unfortunately, we are seeing people getting it 2 and 3 times. So please do not assume that you can't catch it again, particularly in the same household where spread is, of course, much more possible than just out and about. So what can we do? What should we be concerned about? So when you have a positive person in the household, we're going to call that the index case. Then the first day that they have symptoms or the first day of their positive test, whichever came first, is what we're going to call the index date. So that first day that they started feeling sick or that they got the test, that is the date that we're going to go from, and it's going to be whichever happened first. And the days that we're most concerned about are 2 days before the index day, and then about 10 days after the index day. So that there's about a 12 to 14 day period that I think we should be thinking is kind of that transmission zone. So a couple days before the positive test, about 10 days after the positive test, those are the main time we want to be focusing on. So if you've been living in the house with this person every single day, then you want to think a couple days before the index day, were you up close and personal? What was going on? This will kind of give you a sense of if you already caught it. And so of course you are going to go ahead and take a test. A PCR test at this point is not a bad idea at all because you'll still be really early on, and the PCR test is going to be much more sensitive to picking that up than the home antigen test. But remember, every day that you're in the home with this individual is another day that you may be being exposed. So we're going to want to think about each of those days as being a potential exposure date, unless, of course, the positive person is able to go and isolate, let's say, at a hotel or somewhere outside of the home. But right now we're really talking about a positive person in the home. So what do we want to do? Well, hopefully there is a bedroom, a room that person can isolate in. And when I say isolate, ideally we really want them to really isolate. So assuming this is someone who can take care of themselves and who can communicate, through text messaging, or phone or whatever, that's what we want them to do. We don't even want them to come out. If we can bring them their food and everything else, that is even better. If they don't have to be mingling at all, that is what we want. It's almost like them being in a hospital room being quarantined, and you should consider their room contaminated, a quarantine zone. You can consider everything that they're using basically contaminated. And hopefully, if you're in a setting where you don't have to share a bathroom, please arrange for that. So even if 5 people have to use the other bathroom because they're all still negative, and then that person has to use their own bathroom, let them have their own bathroom, because the bathroom is one of the places we get concerned about. And I'll talk about that more in a moment. And so the main things that we're going to want to do is to keep that virus from getting to others through a couple of ways. And we call, one of the ways is source control. And so N95, which would be like a filter on this person's face, is good source control. And remember, the N95 has got straps that go all the way around the head, the 2 straps that go around the head, not the KN95, definitely not a surgical or a cloth. We are going to want an N95 for source control. And I like the N95 more than the KN95 for this because they tend to fit much more snugly. And that is incredibly important when it comes to source control. So meaning, the person's positive, that what they're breathing out has these viral particles in it. We need to invest in an N95 that fits their face well. And it's obviously a whole lot better if you have those on hand before anybody turns positive. So everyone, please do have a stock of well-fitting, they're a little tight, a little uncomfortable, N95s in the home. Even if you don't use them when you go out and about, you're going to need them if someone turns positive, and you're going to try to not let everyone in the house turn positive. So N95s, that's a filter on the face of the person who's infected. Now, also, if everyone else wears N95, that is even better. So now you're protecting yourself, and how and when and where you do that will probably depend a lot on what's going on in the home. What are shared areas, or can you avoid shared areas altogether? Obviously, if it's a child and you're going to need to be in the room with them, then you're definitely going to want to wear an N95 the entire time. And I'll get into that more in a moment. And of course, the ventilation and the filtration in the home is really, really key. So if you have HVAC versus not HVAC, we'll talk about what are the different scenarios that we might want to do there. So if you are going to be sharing air for sure with the person, because you have to be in the same room with them, you are both wearing N95s. That is your best bet. If it's a small child, they don't make N95s for small child. We have KN95s that that come in small sizes. So once again, this is something that you should have in your home just in case any one of the people in your home, especially over 2, they absolutely can wear a mask, and most of them do quite well doing so. Purchase some KN95s because those also have the filtration. They don't necessarily fit as snugly, but for a child, there's not another good choice for filtration. So get that KN95, or actually they have a KF94 as well. And so let me talk for a second about what happens with the virus in the air. So the virus in the air, so we're in the isolation room, got someone who's positive, we know they're breathing out SARS-CoV-2. So the virus in the air can get taken out of the room with ventilation. So that could mean going out a window, which would be great. So you can have windows in the room, great. Hopefully you can keep them open and the virus can just go outside the room. So with good air circulation, good ventilation, the virus can get out of the room. Now, if you have a HVAC system, what we want to make sure is that it doesn't get out of the room and into the rest of the house. So if there is a return air vent, and the return air vent looks like this, then you will want to cover this up. So you can tape some plastic over it, cover it up, because you do not want the virus to get out into the rest of the house. So close or cover the return air vent. And the other way we can clean the air and get the virus out of the air is to filter it inside the room. So that's what those little HEPA filter units are for. So hopefully you've got some of these HEPA filter units, or you can get some. If you only have one, then I would suggest putting it in the person who has COVID's room, because even if some of the air seeps out, then it will have been filtered. And if it's filtered through a HEPA filter, then that HEPA filter actually catches the SARS-CoV-2. So as long as we have enough air exchanges, the air is going through that HEPA filter enough times before the air gets out into the rest of the house some type of way, then that is going to be very useful. If you have more than one HEPA filter, that's even better. So you can put one in the room, one right outside the room is not a bad idea, because then it will just suck in that air and clean that out. If the only one you've got is in the patient's room who has the SARS-CoV-2, you may also want to block the space under the door so that air is not getting out under the door. So an open window and a HEPA filter running the whole time, that is going to be great. You're going to block the return air, and you're going to block the space under the door as well, so that the SARS-CoV-2 doesn't need to get into the rest of the house. The other thing that can happen with the virus is that it can actually kind of lose its infectivity. And early on, we were doing a lot of studies on this, trying to figure out how long SARS-CoV-2 lived on surfaces and things like that. But it seems to just kind of get weaker and weaker over time. Maybe after, an hour or two, it just kind of starts to get weaker and it loses its infectivity. So that's why, let's say that the person leaves the room, you want to wait as long as possible before you go in after them, because even if the air hasn't been very well cleaned or as well ventilated as we might want, it's going to get weaker and kind of lose its infectivity if that person is not in there anymore. And so I'll get to a little bit more about that in a moment. The last thing that can happen with this virus is it can actually drop to the floor. And whether it does that or how long it takes to do that, or whether it just stays floating around in the air as aerosol, depends on a few factors. But the most important factor is the humidity. So, and this is why, we see that in colder temperatures, SARS likes low humidity. It likes cold. So when it is hot and humid, COVID doesn't like it. And actually, a lot of viruses don't like it, a lot of respiratory viruses in particular. So if you've got a humidifier, this is not a bad idea. Just actually, in general, keeping the air humidified. It helps SARS-CoV-2 and even other viruses die more quickly. It also helps those viral particles fall to the floor more quickly. A humidifier is a good idea. You don't want it too humid, because then you start to worry about things like mold and stuff like that if it's just too wet and humid in there. But run a humidifier, especially if the air is dry. And if you can do that in the room of the person who is positive, that is an excellent way to go. So if you have to be in close proximity with someone who's positive, both of you wear a high quality, well-fitting, high filtration mask, preferably an N95, otherwise a good fitting KN95, especially for the little ones. And we know that even if you were to catch it when both of you are wearing masks, what's also important, and it's looking like is important, is how much of it you breathe in. So if someone just sneezes on you and neither of you are wearing a mask and you get a big old dose of SARS-CoV-2, it is looking like not only are you obviously a lot more likely to catch it, but that you also could have a more severe case of it because you're getting a higher dose. So no matter what, this is going to not be in vain, wearing these masks and trying to even not only reduce your likelihood of catching it, but reduce how much of a dose you end up inhaling. So this is something important to think about. And so remember that if you do have HVAC, and most people in the Bay Area really don't have HVAC, but I'll just touch on it for a moment. If you have central air, again, we're going to close that return air. We're going to want to make sure that you have a good filter on there, a MERV 13 filter or higher. This is something you should just do now. Don't wait till somebody in the house has COVID. We want to get good filters. A MERV 13, or even better, is a HEPA filter. Then if you don't have HVAC, then we're looking at the HEPA filter units within the home, within the room, strategically placed. In the person's room, if you got another one, maybe right outside of their room. There's also a homemade version of a HEPA filter called a Corsi Rosenthal box. This is something you can look up. You can actually buy those square filters and make a box with a fan. So I won't get into the instructions here. You can look it up, but that is kind of a cheap and easy way to get yourself a HEPA filter, and those are actually shown to be quite effective at moving the air and then filtering the air within a space. So highly recommend doing that if you don't have HEPA filtration units. And so to kind of summarize, we are going to be wearing masks, we are going to humidify the air, and we are going to clean the air and leave as many of the windows open as possible, not only in the isolation room, but the other rooms. Now, what about the bathroom? Got a lot of questions about the bathroom. So the positive person going to the bathroom, we don't want to go in right after them. We actually want to wait as long as possible. So if you're able to time these things and you have to share a bathroom, the negative people should go first, because we really, it can be hard to clean the air in a bathroom. If you've got a fan, an exhaust fan in the bathroom, fantastic. You should just keep it running all the time. Don't even turn it off. So just keep, if you have to tape it on, because folks are so used to turning it off when they turn off the lights, just tape it on. So that it stays running all the time. This is going to be quite helpful. If you've got a window, you can leave the window open. When you go in the bathroom, if you're going to brush your teeth or take a shower, so you're not going to have a mask on, in other words. So in that case, we know that if the positive person is using the bathroom without a mask on, that little room, because they usually are little, it's going to take a while for the SARS-CoV-2 to clear out of there. So don't go in right behind them, please, especially if you're going to go in without a mask on. So how long? This is hard to say. It depends how big the bathroom is. It depends on whether you do have that fan or not. But best case scenario, we're keeping a fan open all the time. Maybe we're keeping a window a little bit cracked open. Remember that if you are going to be showering, you're going to be increasing the humidity in the room. So you can use that strategically to your advantage. Definitely the humid air is going to help drop those particles down to the floor. So that is a good thing. Please do close the toilet before you flush. I mean, you just should do that in general, because it's not good to have air that's aerosolized, but especially not with virus. We really don't know, how well that can be transmitted that way, but let's just go ahead and close the lid. In fact, anywhere that you are that doesn't have a lid, like in commercial spaces, if you're at the rest, that's when you need a mask on. So that's just something to keep in mind when you use public restrooms, but I digress. So we're at home. We are going to try to avoid going into any small enclosed space after the positive individual. And wait as long as possible. If you've got to go in, maybe 30 minutes, 30 minutes, if you have an exhaust fan running, and just, make sure that if you can go ahead and wear a mask within that space, you do that. We're going to want to obviously clean shared surfaces and things like that. We know that that's not the main way we transmit, but it is a way. So please just, wipe off your shared surfaces, the doorknobs, the flush handle, the light switches, and the faucets, and so on. Those things should be washed or sanitized with bleach. Same thing in the kitchen. There's lots of surfaces, lots of shared surfaces. So if your positive person is going to insist on going in the kitchen and doing something, please make sure that they are wearing an N95 and that they're wiping things down. But ideally, someone can bring them what they need and they don't leave their isolation quarters. Also, they should have their own set of towels and things like that, so that we don't do any cross-contaminating. So they should have all their own stuff to the greatest extent possible, and definitely not use like the towels in the restroom, for example, that others may be using. So they should bring in and out their own items. And so what to do during this time as far as testing, I think there's a few things. First of all, Right when you find out this person turns positive, remember there's probably a few days before that where they were contagious. That is pre-symptomatic. So before they start feeling sick, they were still potentially contagious. So you should have considered yourself exposed all those days. So by the time they're contagious or test positive, usually it's probably about the time where you want to go ahead and get a PCR test if positive. You can start with the home antigen test. It's going to be helpful if it's positive. It's positive, you're positive. You're done testing. Now we're going to go into what to do when you're positive. But if it's negative, you still got a chance. And the PCR is going to be a lot more accurate at this stage early on. So you may want to go ahead and get a PCR that day. But go ahead and continue doing the antigen testing every day or two, and consider yourself potentially positive the whole time. So that I think that you should say 14 days. So if you take the index day, so your positive family member, a couple days before they started with symptoms, from that day, count about 14 days. I think that whole entire time you should just consider yourself infectious, meaning wear an N95 if you're going around other people. Maybe avoid going around anybody that you think is vulnerable. We don't want to keep on causing forward transmission of this virus. And when you have a household contact, that really is the most likely way that people are catching it right now. Again, it's not inevitable. It's not impossible to avoid it, but go ahead and test yourself every day or two. When your household member is feeling better, when their test turns negative, ideally, then that's when they're no longer very contagious. They may still have a couple of days straggling. These things are not perfect at all. But I think counting the 14 days is probably your safest bet. But also when that person turns negative, that lets you know that they're not really shedding a lot. We do want them to continue also to wear an N95 for at least a full 10 days. 14 is even better because they still could be shedding. And certainly with someone who's, let's say, vulnerable, let's say we have a little one who's not vaccinated yet, or anyone who's not vaccinated yet for that matter, even those low levels, they are certainly vulnerable to that. So you could keep testing every day or two until either your test turns positive, but hopefully it won't, or until those 10 days pass, 10 to 14 days past the index date. So stay vigilant. You can avoid infection. It just takes a little effort and multiple layers, and they're the same layers for the most part that we've been discussing all this time. And remember, the most important thing you can do to protect yourself is to get vaccinated, get boosted. Please talk to your family members, your loved ones. We're still hearing a lot of folks saying, I'm good. I had my first 2 doses. I'm not getting another one. Or we're hearing a lot of our elders saying, I got my first booster. I don't need a second one. Really think about it, especially if you're in a household with people who are going in and out. There's a lot of transmission out there. A lot of people are testing positive right now. You don't want to end up regretting the fact that you didn't just go ahead and bite the bullet and get that next dose. I know that it's not what we all want, but it is the best way to protect yourself from the most severe and tragic outcomes of SARS-CoV-2. So vaccinate and boost, still very, very effective. And if you do catch it and you're someone who should be treated, please, please, please advocate for yourself to get treated. In fact, I want you to have that conversation with your doctor now. Should I get treatment if I'm positive? If so, are you going to give it to me? We're still hearing that some primary care doctors are not prescribing it, or they are not getting back in time. Even the test to treat pharmacies, we're in a surge. We are in a wave, and some of them are getting overwhelmed and they don't have enough space for you. So if you don't have an appointment for 4 days and you get outside of that 5-day window, you're no longer going to be eligible for that treatment. So please get all your ducks in a row now. Don't let anybody tell you that you can't get on Paxlovid just because you're on a cholesterol medication. Getting that feedback quite a bit. You have to stop your cholesterol medication while you're taking Paxlovid, and you have to continue to hold off on it, usually for 3 to 5 days after the Paxlovid is done. But this is not a reason not to get it. In fact, people who are on cholesterol medications, may be really actually at higher risk of not doing well from COVID untreated. So please advocate for yourself. Make sure that you're not being told no prematurely. It's a lot better if you get all this squared away right now with your primary care doctor. Don't wait until you need the treatment to get this all sorted out. This is not something that has anything to do with how sick you feel. If you get too sick, it's too late for the treatment. And so this is really about your underlying conditions. The list of those conditions from the CDC is in the post, so please check it out, discuss it with your physician. And please be sure to get out, get some fresh air, enjoy this beautiful weather, eat a good balanced diet, get some exercise, keep your stress levels down, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We look forward to seeing you again next Tuesday at 10 a.m. See you then.